cytochrome 1A1, the product is 2-hydroxyestradiol. And so the other name for 2-hydroxyestradiol is it is a catechol estrogen, which makes it a substrate for COMT because COMT is a catechol O-methyltransferase. So 2-hydroxyestradiol turns out to be the preferred estrogen substrate of COMT. The other product that can be formed from estrogen by cytochrome oxidation is cytochrome 1B1 produces 4-hydroxyestradiol. 4-hydroxyestradiol can be metabolized by COMT, but it's been shown that 2-hydroxyestradiol has a much higher affinity and a much faster turnover rate than 4-hydroxy does, which implies that 4-hydroxyestradiol is not the preferred substrate of COMT. And the issue with this is that if estrogen is being converted to 4-hydroxyestradiol in a faster rate because of the cytochrome SNP, this is cytochrome 1B1 has been characterized to overproduce 4-hydroxyestradiol. 4-hydroxyestradiol can both enzymatically and spontaneously decompose into what's known as an estrogen quinone. The estrogen quinones are known as depurinating agents. And what depurinating agents do is they make breaks in DNA chains, and obviously that's not a good thing. This pattern that we see here, this cytochrome 1B1, GSTP1, is very common in ovarian cancer. And yes, quinones are more carcinogenic than the estradiols. Great question. I mean, the problem with the 2-hydroxy and the 4-hydroxyestradiol is that they are carcinogenic because they still retain estrogen receptor binding capacity. And so for estrogen positive cancers, the 2-hydroxyestradiol and the 4-hydroxyestradiol are still activating the estrogen side of that cancer. Whereas the quinones are even more carcinogenic because they're not having an estrogen binding capacity, they're breaking DNA. And so that tends to be worse for the outcome of female reproductive cancers when they're estrogen positive. The relationship between the quinones and the GSTP1 and the GSTT1 is that quinones are quenched by glutathione by the GSTP1 and GSTT1. And the significance of the GSTP1 is that it is a cytosolic enzyme. It's found in the cytosol of the cell, and so it's going to get the quinones when they're in the cytosol. The GSTT1 is a nuclear enzyme that protects the nucleus from quinone damage. And so for patients that have the GSTT1 deletion and they have the CYP1B1 homozygous, that is one of the most common patterns that we're seeing in an ovarian cancer population. And the basic idea is that these patients that have the cytochrome 1B1 overproduction of the 4-hydroxyestradiol and they can't protect their cells from damage from the quinones that result with their DNA or with glutathione, they tend to have worse outcomes in terms of cancer progression. Now, the beautiful thing about this is because 2-hydroxyestradiol and 4-hydroxyestradiol are metabolized by COMT, if we can improve the patient's COMT function, theoretically, we should be able to reduce their risk of being affected by the carcinogenic intermediates of estrogen metabolism. And so, of course, remember, COMT being phase 2, if phase 2 is sluggish and phase 3, what's phase 3? I like to joke, I have this running joke with Lynn that phase 3 detoxification is a bowel movement. If you're not having regular bowel movements and you have sluggish COMT function and your body is slow to produce SAM, strike 3, kids, you're out. So the idea is if we can improve COMT function, if we can improve bowel function, we can lower the risk that these women are seeing based upon their